Now, last night, Health Minister Bhekisisa confirmed that we are in a second wave of COVID-19 infections. Let's bring up some of those graphs, Stephen, and take a look at what's happening. Now, daily additional infections shot up by 6,700.
There were an additional 142 deaths and now 51,000 active cases.
The Western Cape has the highest number of active cases at more than 17,000. KwaZulu-Natal has 11,000, while the Eastern Cape has 9,500, with Gauteng on 5,000.
The Health Minister did point out the doubling rate in the more populous provinces like Gauteng would be more rapid. More than 50,000 tests were conducted in a 24-hour period. Perhaps the most important outcome of flattening the curve is to try and keep hospital admissions manageable to ensure that they have enough capacity.
Well, here's a snapshot of hospital admissions in different provinces, something we need to keep in mind when deciding how to respond to the second wave of COVID-19. While the race for a COVID-19 vaccine has 4 candidates nearing the finish line, with some getting ready to roll out before the end of the year. But what do the reported efficacy results actually mean, and how much will doses cost? That's just some of the questions being asked. We're joined by Aisha Abdool Karim of the Bhekisisa Center for Health Journalism. Aisha, good evening, and thank you so much for your time tonight. The early data of the 4 COVID vaccines was last month, with most of the jabs showing an efficacy rate of 90% or higher. What does this actually mean?
Yes, so in fact, we actually have results from 5 jabs, because a Chinese vaccine had early data released yesterday as well, also showing around 80% efficacy. But essentially, what it means is that if you say that a jab is effective, and if it has a 90% efficacy, it means that 9 in 10 people who received the shot in a trial setting, as opposed to getting a placebo shot, did not develop COVID-19 symptoms or was protected from developing the disease. So each trial essentially measures how many cases of COVID-19 they see, and they have a certain benchmark for when they start to do an analysis, and when they see of those cases how many people got the placebo shot, which is not any kind of treatment or anything, and then how many actually received the real vaccine. And then based on those numbers, they release the efficacy rate for their vaccine.
Now, the UK has already approved its first COVID vaccine, and people have begun with the immunizations. The US is also set to follow. Of course, many South Africans are also wondering, when can we expect it to hit our shores?
Yes, so I think, with the UK and the US, they were able to procure their doses preemptively very early on in the process. Several wealthier countries bought millions of doses from multiple companies without knowing what the results were going to be or which candidate would release results first. And so that's why now, when those results are coming out, those countries are able to move ahead very quickly and start securing doses. South Africa, unfortunately, does not have the same amount of expendable income. And so we need to be taking a much more considered approach towards which vaccine we need to procure. And keeping in mind that the end goal is to immunize as many people as possible, cost is a huge factor in terms of which vaccine South Africa will be procuring. So far, we are looking at potentially having a vaccine by the middle of next year, but we're not going to be jumping straight in like the UK or the US and just procuring whichever vaccine has the best results or the first results, because we need to be looking at which vaccine is best for our population and what will have the best plan for rollout and what will be the easiest to reach the most people in our country.
Absolutely. Aisha Abdool Karim, let's leave it there for tonight. She's with the Bhekisisa Center for Healthcare Journalism.